Hi there. My name is Mark Oldham, and I'm an assistant professor of psychiatry at the University of Rochester Medical Center. And pertinent to this presentation, I'm the treasurer of the American Delirium Society, which is the organization here in the United States focused on advancing the science and practice of delirium. And so this is my presentation. This is why delirium matters to me. And so this is, it's really fascinating. I'm going to start. I'm going to start somewhere that most people probably wouldn't expect to start. I'm going to start with physics because physics is wonderful. So I'm going to go back to 1666. This was Isaac Newton's miracle year, or Annus Mirabilis. He did a lot of things that year. The optics of light for one, but also, gravity and some of the foundations of calculus. But in a series of experiments that he conducted, he took a prism and he refracted white light into kind of the full spectrum of visible light, kind of creating the rainbow here. And then what he did is he took a second prism and he rotated, inverted it to see what he would do, what would happen to these, again, these various strands of colored light. And and could he put it back together? And actually, one of the experiments, he demonstrated that you could reconstitute this refracted light. And from this experiment, he what was based in the series of experiments and subsequent experiments, he developed what he called and what was known as the corpuscular theory of light. That light is essentially little bodies within it. Of course, now we talk about photons and also waves as well. So, but again, why am I talking about physics? Delirium is very much I think a good analogy here is it's very similar to light. What do I mean by that? So when a person develops delirium, their sense of self, their consciousness, their awareness, and their sensorium, the ordinarily integrated aspects of who they are in a mental space, as well as their ability to engage in goal directed activity, their personality. These things essentially are refracted. We see the elements of consciousness displayed in in unique ways that we wouldn't see were it not for the very nature of delirium. And so, in a similar way, I think we could consider the constituents of the mind. In the very core of the mind, we have arousal and awareness. Arousal is how much, kind of a quantitative measure, and awareness is a qualitative measure. So how clear. So again, conceptual clarity. And then emanating from this, or maybe in kind of a map around it, we have various aspects of the mind. And so mood and affect, behavior, perceptual clarity, personality, um, orientation and cognition, right? These are the facets of the mind that begin to be, in a way, resolved, refracted in the experience of delirium. Now, I don't want in any way to romanticize delirium, but I think from a conceptual or theoretical basis, it is a compelling fact of the mind that delirium should do this and should present with such, again, this kind of dappled presentation. But again, I'm not romanticizing it because, in fact, delirium is, and why it matters, delirium is ominous. Hospital outcomes and long-term outcomes of individuals who developed delirium are poor. We've known this for decades. Not only that, it's dangerous to have delirium. When a person has delirium, they make bad decisions very often. They can cause harm to themselves and others. For instance, a person might forget that they had a surgery and get up, start walking, and have a fall because they're unsteady on their feet. Maybe they're just not eating. They can be impulsive, combative, even at times really impairing their own recovery by self-extubation, removing, central lines. Again, impulsively, not thinking about it, just not knowing what's happening around them. So it can absolutely be dangerous. From a psychiatric perspective, delirium is a chameleon, or is like a chameleon in that it can present with essentially any of the psychiatric symptoms that might present in kind of what we would call primary psychiatric conditions. So they range really across the spectrum, and most of them are extremely distressing to the patient, to those around them, family members, clinicians, and so they can include illusions, hallucinations, and other perceptual changes, personality change, despondency, and the like. Again, essentially any symptom that could be seen in a psychiatric condition can be seen in delirium. And again, these cause a great deal of distress. But not only that, delirium is, again, because it unravels the experience of the individual so consummately at times, it can be an existential experience, almost like a waking nightmare. And so, when a person is in bed or they're in the hospital and they're kind of maybe in the chair beside their bed or walking around and they're delirious, and someone comes to help them, they might see that individual as someone who's trying to harm them. If it's part of a broader kind of nightmare experience, or someone's trying to give, insulin by a needle, I mean, it's not common that people would stop you on the street and stab you with a needle. And so, again, if the context is missing, and you're not sure where you are, even routine care can be perceived as danger. And so someone might be combative, not because they want to be combative, but again, because they're afraid. And so these dissociative experiences, can ultimately lead to, after the experience, even PTSD, which has definitely been reported after delirium in some instances. And I guess if we were to put all this together, delirium is life interrupted. Nobody in delirium is living their best life. I've yet to meet the person whose life was enhanced in the moment by the experience of delirium. You're not spending time with friends and family. You're not going to work if you enjoy work. You're you're not engaged in hobbies. You're not going out to eat, right? So these are things that life is on hold in delirium. So delirium is life interrupted. And so I think if we put all of these together, I think this quote, which I'll read in just a second, really synthesizes the broader concepts that I've been talking about. I love this quote, probably one of the most memorable quotes that I've ever read about delirium. This is by Zbigniew Lepowski in '89. This is in his book, the second of two books that he wrote on delirium. And so he writes, delirium poses intriguing questions for everyone interested in brain behavior relationships, cognition, consciousness, attention, the sleep wake cycle, perceptual disturbances, and organization of the mind, which is something that we've really been talking about here. Delirium is an experiment of nature that may be observed daily on any medical or surgical ward. And I want to end here on this idea of experiment because, again, I started with physics, we'll end with physics because there is much to be said about this idea of the mind having its constituents, like white light, kind of polychromatic white light, having multiple wavelengths constitute that white light. And so what I've been talking about here is the experiment of nature on the left side of the screen, which is where a prism, again, refracts the light so as to expand all of the wavelengths so that you can see them. What I've not talked about as much is the second prism that's inverted that restores visually the white light from the beginning. And I think that's really why delirium matters to me. I think if we put all this together, I think the narrative arc ends with the second prism. That's the experiments that we need to be doing in research settings in order to restore the mind. In most instances, delirium is a short-lived, short-lived condition, but we know again it has really, really dismal outcomes very often, and not everyone comes fully back to their original baseline. And I think that's what should compel us. That is what, in my mind, is most compelling about delirium. That is, delirium matters because our goal yet remains for our patients to restore the mind. And so let me conclude here just by giving a quick shout out to the American Delirium Society's virtual meeting in 2021. It's going to be June 13th through the 15th. I would say, please, if you're interested in delirium, if you want to learn more about it, if you want to meet other colleagues who are passionate about delirium, advancing, again, the science and practice of delirium, please join us in June for the virtual meeting. Again, thanks so much. I really appreciate it.